So a blepharoplasty or eyelid lift is a procedure where skin and or fat is removed from either the upper or the lower eyelids. It's typically one of the first signs of aging. So typically most patients, before they even need a facelift, typically they need an eyelid lift. It's typically the area of the face that starts the aging process the first. For the upper eyelids, it's a procedure where a scar is made in the actual crease of the upper eyelid. So it's a barely visible scar, and eventually it fades so you never see it. Fat and skin is removed, and typically, depending on the amount of aging and what's called brow ptosis, we can actually place a device to lift the brow up through the same cut without any cuts in the forehead. And that's called a transblepharoplasty brow lift. So we actually could do a brow lift through the upper eyelid skin without any scars on the outside. So typically I recommend patients to have the upper eyelids done first, not at the same time as the lower eyelids. If you do upper and lower eyelid surgery together, typically recovery is more like 3 weeks to a month. And most patients don't have a lot of downtime to commit to that kind of a procedure. But if we split them, when we do the upper eyelid and the brow at the same time, it's about a week of downtime. Then we do a lower eyelid, and that's another week of downtime, which is a lot more manageable. The lower eyelid surgery is done right at the lash line, and it comes a little bit in the corner of the eyelid and just removes the bagginess or the loose skin in the lower eyelid that is paramount to many patients. It's probably the most common procedure that I do in men. It's something that if done properly, nobody will see the scars. It doesn't have any telltale signs of a done look, and it looks very natural and takes quite a few years off the eyelids. Some of the newer non-surgical procedures for the eyelids have to do with filling of the trough, kind of like the darkening area, which typically happens because of shadowing. Those could be filled with a product called Restylane or Juvederm, as well as a new product called Kybella, where actually with injections we can make the bagginess or the fat cells go away from the lower part of the eyelid. So those are newer ways of doing non-surgical procedures unless a patient really needs a surgical procedure.